Diabetes Family Education, Understanding HbA1c or Hemoglobin A1C in Type 1 Diabetes by the Diabetes Education Program at the Hospital for Sick Children. This resource looks at what HbA1c is and how it is used to help manage blood sugar levels in people living with Type 1 diabetes. Please note, the images in this resource are for illustrative purposes only and do not constitute the hospital's endorsement of a specific brand or product. Hemoglobin A1C, or HbA1c, is a type of blood test that measures the amount of sugar that is attached to your hemoglobin. When sugar enters your bloodstream, it attaches to hemoglobin, a protein in your red blood cells. The more sugar you have in your bloodstream, the more sugar will attach to the hemoglobin. A1C is measured as a percentage and estimates the blood sugar levels over the past 3 months. A1C is not the same as blood sugar levels measured in millimoles per liter, which only tell you what the blood sugar level is at that moment. This image shows how the individual A1C results correspond to the blood sugar range. For example, if the A1C is measured at 9%, this means the estimated blood sugar levels over the past 3 months were between 11 and 13 millimoles per liter. A normal A1C for someone without diabetes is below 6%. For children with type 1 diabetes, the international guidelines target an A1C level of less than 7%. To reach this target, you should aim for pre-meal blood sugar levels of 4 to 8 millimoles per liter, and if wearing a sensor, the time in range, which is 3.9 to 10 millimoles per liter, should be at least 70% or more. A1C is a predictor of long-term health outcomes. If blood sugar levels are high for a long time, this can be harmful to small and large blood vessels all over the body. Let's look at one important study. The Diabetes Control and Complications Trial, or DCCT. The purpose of the DCCT study was to determine if the possible long-term complications of type 1 diabetes could be prevented or delayed. Over 1,400 patients with type 1 diabetes participated between the years 1982 and 1993 and were grouped into one of two categories: the conventional group and the intensive group. The conventional group monitored their blood sugar level once a day, while the intensive group monitored their blood sugar level 4 or more times a day. The conventional group had 1 or 2 insulin injections per day, while the intensive group had 3 or more insulin injections per day or used an insulin pump. The conventional group avoided signs of high and low blood sugar, while the intensive group targeted specific blood sugar levels. The trial showed the conventional group maintained an A1C of 9%, while the intensive group was lower, at 7%. The study ended earlier than planned because those in the intensive group showed a lowered risk of having long-term complications affecting the eyes, kidneys, and nerves. This risk was lowered by 50% or more. Because of the monumental findings of the DCCT research study, the diabetes community was made aware of what an important predictor blood sugar control shown by an A1C result is for long-term health outcomes. Keeping A1C values within the target range is important for overall health, both now and in the future. We are here to help. If you have questions or need further tips, please contact your diabetes team.